Hello, and welcome to the Focus on Eye Health Expert Series. I'm Kira Baldonado, Vice President of Public Health and Policy at Prevent Blindness. Joining me today is Dr. Lauren Ditta, Pediatric Neuro-Ophthalmologist at Le Bonheur Children's Hospital, and Associate Professor of Ophthalmology and Pediatrics at the Hamilton Eye Institute at the University of Tennessee Health Science Center. Welcome, Dr. Ditta.
Thank you, Kira. I'm happy to be here.
Thank you. And I'd like to start off for our audience today about a little bit about your title. So, you are a pediatric ophthalmologist and a neuro-ophthalmologist. Can you explain what a neuro-ophthalmologist is?
Sure. I think the easiest way to explain it is to just talk about my journey into that training. I'm an ophthalmologist, so went to medical school. And then when I completed my residency, I did specialized training in pediatric ophthalmology. And then after that, I did a consecutive fellowship in neuro-ophthalmology. And so neuro-ophthalmologists really specialize in the relationship between how the brain processes vision and how it then can affect vision in various numbers of ways. So the eyes are really an extension of the brain. So when I talk about vision, the eyes are a window bringing the visual input in, but the brain really has to process that. And so there can be many conditions that can affect vision, either in the way that the eye sees, so clarity of vision, but also the way the eye moves, in various different types of function. So neuro-ophthalmologists can have ophthalmology training like myself, or can come from a neurology background. And so my area of expertise is really looking at those conditions in children.
Oh, that's wonderful. And I really appreciate that statement that the eyes are an extension to the brain. There's such a strong connection there. So, in your practice, what are some of the most common vision issues that you treat in children?
Sure. Many children have various types of refractive errors, which really is just a need for glasses. So, farsightedness, nearsightedness, as well as astigmatism. A common condition that I see often in children is something called strabismus. It's just a fancy word for ocular misalignment. So, the eyes can be out of sync vertically or horizontally. And so, we can treat that either with glasses, or sometimes we need to do surgery to straighten the eyes. And the reason we do that is because we have two eyes and they were meant to be used together and in sync. So we want to get those eyes straight so patients can have single binocular, meaning using both eyes together, vision. And then as a neuro-ophthalmologist, quite often I'm asked to look at children's optic nerves. Everyone's created a little bit differently, but the optic nerve can tell quite a bit about what's going on in the brain. And so oftentimes I'll be evaluating the optic nerve to make sure it looks healthy, or could it be swollen? And could that be a heralding sign of pathology going on in the brain? So those I would say are the most common things that I see in my practice.
Now, for our audience, one of the terms they might have commonly heard is refractive errors, and you said you see a lot of that in your practice. I know that nearsightedness or myopia is talked about a lot now. There's a dramatic rise in that across the globe, and we talk a lot about myopia, but what's not talked about a lot are those lifelong considerations for children with high myopia. So, talk to our audience a little bit about what are those considerations and why should we really be paying attention to myopia now at its treatable stage?
Sure. I think the myopia epidemic really came to a head during the pandemic. And many parents and many ophthalmologists became concerned about this virtual learning when so much of the education was right in front of the child sitting on a computer all day. And so what that does is when we're looking at things up close, our eyes are in a constant state of over focus, or what we call accommodation. And so when the eyes are trained to be set like that, what happens is over time the eyes just want to be naturally in that position, and so it can create nearsightedness. Nearsightedness is a term that means you can see up close, but it's blurry or difficult for you to see at distance. And so patients need glasses to see. And the more that you stress the eyes and try to over focus, will create more and more nearsightedness over time. And so it is a challenging thing when talking with parents about talking about conditions that may be present now, but then may progress over time, and treating it now because it's hard to know, well, I'll wait to do it next time, or maybe at the next visit we'll address it, but it is a progressive thing. And our society now, with all of the technology being so up close in our faces on the phones, we're really just in a constant state of over focus and over accommodation. And so over the last couple of years, there's really been a lot of studies that have been going on for some time, but more discussions about ways to kind of halt this over focusing, this myopic progression. There are drops that can be used in the eye. And so we want to slow down that myopic progression, because later on in life, the more nearsighted you are, it can cause the eye to behave differently. It puts patients at risk not only to be completely dependent on glasses or contacts to see, which in and of itself is a very big risk for patients who maybe don't have the ability to get glasses or contacts on a frequent basis. That's actually quite a big issue. But the other thing is it puts patients at risk for retinal detachments, retinal holes and tears. And if the eye is struck at any point, any type of trauma, the eye can be more sensitive to damage. So really, we want to create these situations where patients, if we're not treating myopia directly, we at least educate parents and patients to say, if you're using devices and looking at things up close, you want to take breaks, give those eyes a period of rest where you're doing something, you're outside, you're looking at a distance, so that over focusing isn't in a constant state all the time.
That's really important. Special messages for those parents out there struggling with the kiddos on screens, to take those breaks, to make sure they're blinking, to get outside. And there's so many reasons to get outside. This is another one, another reason to have parents tell their kids that. So thanks for those tips. Another condition that I'm starting to hear more about, and there's more research on, is cerebral vision impairment, sometimes called cortical vision impairment or CVI. It's a condition that is being talked about more. What exactly is this condition, and what do parents need to know? What can they do, or how it can be treated at this point in time, if possible?
Kira, yeah, I'm so glad you brought this up. The National Institutes of Health, the APOS organization, so Pediatric Ophthalmology Organization, and really many organizations have banded together to provide education and awareness of cerebral visual impairment. And you're right, it can go by different names. There's actually a consensus group right now really working to fully define what cerebral visual impairment is. And in a nutshell, what it is it's a condition that has to do with the way that visual information is processed in the brain. So as I'd mentioned before, the eyes are just that window, and then the visual information gets processed in the brain. And so children with visual impairment, and we talk about it in children because oftentimes it's a condition that's acquired in and around the perinatal period. So for a while, retinopathy of prematurity, for example, was one of the leading causes of blindness in premature babies. As technology has gotten better, premature infants are surviving, and they're doing much better. We found that there are these secondary sort of sequelae to the brain that secondarily impair vision. And this can manifest in any number of ways. Again, it could be the clarity of vision, but it may also be the way that children respond to visual stimuli. It may take them longer to identify things. They may have behaviors where they're able to process the vision and visual stimuli better in backgrounds that aren't maybe very chaotic, very simple backgrounds. And so we're learning more and more about the characteristics that children with this condition exhibit. And so that's really important because we want to know how we can treat it, and if we can do things to help these children improve their vision over time. I think it can be very challenging because new parents especially don't know what babies are supposed to see and when they're supposed to see it. And so in my practice, I really do educate parents about visual milestones. For example, at 3 months of age, a child should be able to lock in and track on their parent. So if they're moving their head side to side, a baby will move their eyes to their parent. And that's a really important milestone because it tells us that the kid's getting good information, the baby's getting good information, visual information, and responding to it. And a lot of children with cerebral visual impairment early on may not be doing that. In fact, parents may say, my child looks through me. I just really don't think that they're appreciating my face, and so it does affect those early bonds and relationships. But CVI is not just limited to children; it's really anyone who's had any type of insult to the brain, so stroke or trauma. The brain processes all that visual information, and so there are conditions that can cause that are acquired later in life. The other thing about CVI is that for babies who have this, it's really a lifelong condition. The brain is very neuroplastic. So, how the brain is affected and how it's now seeing, those changes are lifelong and constantly adapting to the visual stimuli in the world based on what visual connectivity is there or what's maybe not there. So it is something that we see all throughout the lifespan, and we need to address this and educate, because there are accommodations that can be made for these patients over the course of their life.
If a child is diagnosed with CVI, what sorts of help are out there for the child or for the adult that is impacted by this condition?
Yeah, I think the most important thing that, let's say, an ophthalmologist can do, but even a parent can do, is identify that there is an issue with vision. And as an ophthalmologist, one of the most important things I do is treat treatable causes of things that I see that I can treat. So, in other words, if a child, in addition, maybe needs glasses, if the eyes are misaligned, if there's any treatment that we need to do, we go ahead and address that, because we want to get the vision as best as we can get it, as the starting point. From there, we really want to tap into our resources with either teachers for the visually impaired or early intervention services, because we want to advocate early for these children, making sure that they end up meeting milestones, or at least are aware of milestones that need to be reached at various ages. I think one of the most important things people need to realize, if they haven't, is that a child's vision is really the first sense they have that will allow them to go out and explore the world. That's why a baby will go out and touch things, explore things, their ability to go out and crawl. It's because they see things they want to attain. And so when the vision's affected, everything sort of seems to be delayed. The motor milestones, the speech milestones, again, the relationship with a parent, because they're not making those connections, those good, strong connections, because vision is impaired. So I think the most important thing we can do is, number one, identify it. And then from there, treat what we can treat, and then tap into those resources, early intervention, teachers for the visually impaired. And then for adults who have it, is getting them into rehab programs, again, visual rehabilitation programs, and things like that. Caregivers, parents, family members really are the strongest advocates for these patients who are affected. And so I really empower them to go out and we give them the tools to be able to advocate for their patients. There are so many people who can help us, but really it's the parents and the caregivers and the family members who can make those relationships happen.
Yeah, I agree. It really takes a team to support the child
Absolutely.
and their vision and eye health. You said a couple of things about the importance of milestones being met visually for babies as they grow and develop. But we know that vision problems can occur throughout the spectrum of childhood. So it's important to have those regular screenings and eye exams and keep a watch on a child's vision. But oftentimes they're not aware that they have a vision problem. Kids can accommodate and have workarounds that make it hard to sense that vision might be one of the problems. So as a child ages, what are some of those signs that a parent might look for, or a teacher or some other care provider, to say, hey, maybe we should get their vision checked out?
Absolutely. Children surprise me all the time. They're so smart, and they do things in order to try to either compensate or accommodate, or get their eyes to work for them. So a couple of things. First off, sometimes children who have a vision issue in maybe one eye and not the other, they're going to preferentially use the better seeing eye. So when parents come in, they bring their child in and they say, oh my gosh, I had no idea that my child's vision was so poor in one eye. Children are smart, they'll use the better seeing eye. So um, a lot of pediatrician offices now are doing basic screens. And when you do a basic screen, you really want to make sure you're checking each eye individually, because you want to test them separately. Um, and so that's really important. If the pediatrician isn't doing screens, I think it's great to have really all children have their vision screened right about that age when they're going into school. That early, 5 years of age, kindergarten, just get a basic screen to make sure that the vision is good when starting school. Obviously, if there are issues before that, that's a different story. Some things before that or other concerning things might be the red reflex. Cameras are so good these days, it kind of filters that out. But sometimes you can see with a flash that the reflex between the eyes is asymmetric. That can be a sign that there's pathology, a lesion in the eye, or something like that, like a cataract or a tumor, or even that the eye is misaligned. For example, the reflex, if it's off in one eye, could be that the eye is not centered or straight. So those are some things that if parents see that, that would be a reason to bring a child into the ophthalmologist for an evaluation. The other things that the eyes, again, should move together. They should be steady movements. Anything that looks like the eyes aren't moving together, the eyes are shaking, crossing, turning. Obviously, we need to get an evaluation there. The other thing I would say is children who kind of have a head position. Again, they're really smart. They do it because they want to put their eyes in alignment. So a persistent head position or a head turn might be worth getting an evaluation to make sure that vision in the eyes are not the driver of that. And then obviously in school, if a child's performance or behavior, really declines, if they're not seeing well, seating in the classroom, could be that they just need glasses. So all of those things I think are just, signs to bring the child in for an evaluation. But again, they're pretty sneaky, and sometimes it's a child who can mask they end up showing up really late. And either way, we get them evaluated and we see what we can do, because even if late, there are some things we can do for rehabilitation to improve vision.
Yeah, great tips there. Always think about vision as one of those first things to check out if your kiddo's not keeping up with reading or having some of those signs that you just mentioned there. I also appreciate that you talked about being an advocate, and it seems that you're an advocate for low vision resources and access to care. But not everybody may be familiar with that term low vision. Can you talk a little bit about what that term means and how we might encourage caregivers or parents or loved ones to advocate for their child or their loved one who may have low vision?
Sure. So, the way we record our vision here in the States is we say something like 20/20. So we record it in feet, and 20/20 would be sort of the perfect vision, so to speak. Anyone whose vision drops below, say, 20/40, which basically means that the patient, let's say they're at 20 feet, a person with perfect vision would be able to see that at 40 feet. So, and again, the larger the bottom number gets, the worse the vision. So when you get in that range of 20/40, first off, there are states where that is sort of the minimum requirement for obtaining a driver's license unrestricted. So when you get below that, that vision that's affected can impair various aspects of life, activities up close or at a distance. And so we call low vision just really a range of where the vision is not perfect, but it kind of falls in a 20/40, 20/60, 20/80, any of those ranges there. The worse the vision gets, you can fall into a range of legal blindness. And really, when patients have vision that's affected, it impairs many aspects of life, activities of daily living. For children, it's very important because it can limit or reduce the ability to access educational resources in the classroom, because if you can't see, you can't utilize the information being given to you. And so, when I talk to parents, I think it's really important to have a conversation about objectively the findings that, let's say, I see. In my clinic, I'm just really seeing a snapshot of what a child can do. But what I ask the parent is how are they functioning in daily life? Because sometimes those match up really well, and sometimes they don't. And so when I talk to parents about advocating for their children, it can be a very challenging conversation to tell a parent, look, I'm really concerned about your child's vision. I'm worried that they're going to struggle with various aspects of their learning activities. I'm worried about, activities where something's coming at their face, like a baseball or sports and things. And I want to make sure that they're safe. And so I talk to parents about that, because when there's maybe a mismatch, a child says, my child's functioning just fine. I really talk them through, well, this is what we want to make sure they have access to. We want to make sure that, a 5-year-old who may be doing just fine, as education gets more challenging, they're reading more, the comprehension, the learning, the activities that they're doing gets more challenging. That visual demand is really, really tasked. And so we want to make sure that resources are in place for them in the classroom. And then we want to make sure they're safe in their activities of daily life. So when I talk to parents about reduced vision, whether it's low vision, sort of just mildly reduced, versus visual impairment, markedly reduced, we want to make sure that parents understand the reasoning why we identify that, and then why we want to go through the process of obtaining resources for them. It's for their safety. It's to ensure that they're successful in school, and it's really to just ensure that, when as they get older into adulthood, we're not creating new problems that haven't been addressed and streamlined early in life.
Anything else that you would like to share with our audience, Dr. Ditta, about vision, eye health, children, or vision rehabilitation?
I think that, again, the big thing I want to reiterate is it is a team effort. Um, I'm one part of the team as an ophthalmologist, but I think in my journey, in learning more about visual impairment, there are things I know that I can directly address and treat and fix. And there are other aspects where it's sort of a marathon, not a sprint, of really trying to get children resources over the course of their lifetime to improve quality of life. Babies grow up to adolescents and then adults, and we want to make sure that we have education and resources in place throughout the lifespan. Um, I always advocate for seeing your ophthalmologist early. Again, I think seeing them at the start of school, in that early kindergarten years, just to make sure everything's great, is a good way to just check out the eye health. And then again, when there are problems, and the ophthalmologist is always there. Pediatric ophthalmologists may be few and far between, but they're excellent. Our field is really advocates for children, and it's an amazing subspecialty.
I love that. Thank you, Dr. Ditta, for being
You're
here
welcome.
today and for all that you do to keep vision healthy. For more information about the topics that we discussed today, go to preventblindness.org, and we'll see you next time.
Thank you.